Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine. In today's video, we'll discuss about infant deaths. So, infant deaths or infanticide by definition is a deliberate, unlawful destruction of a child under the age of 1 year by act of omission or act of commission. So, by definition, infant is a child who is less than 1 year of age, and any in less than 1 year of child, if any deliberate, unlawful destruction occurs by act of omission, like not killing the child, or act of commission of doing some act of directly killing the child, is considered as infanticide. So, killing of an infant before any part of the body is born, if any part of the body is not born, is not considered as homicide. But destruction of an infant after any part of it has been brought forth externally to the mother, even before it is completely born, is homicide. So, if any part of the body has been born and it has been killed, then becomes a homicide. But even if only if the child inside if it is still in the womb, then it is not considered as homicide. In India, from legal point of view, irrespective of age of the child, the offence against the child are dealt with the same line as adult. So infanticide legally amounts to homicide. So it is considered as equally equivalent to that of a homicide. So any child death of an infant is considered as like a homicide only of adult, and it is punishable similar to that of a homicide. There are different motives of infanticide. For few includes like a female infant. So it is in India it is more common where if a child is born, a female child is born, then they try to kill by the husband or the relatives of the husband. In certain because of some superstition also they kill the child. Sometimes there is an illegitimate child, the mother may try to kill the child. Then sometimes child born of a widow or unmarried female may try to kill the born child. Then parents belong to socially or economically weaker section because they can't afford a child, growing a child. Then they try to kill the child. These are the different motives of infanticide. Now coming to aims of medical autopsy. So usually the medical autopsy done in adults, the aims include different which usually includes like identification, then determining the cause of injuries, then weapons causing the injuries. In infants, the aims of medical autopsy doing on infant is slightly differ. So first includes whether the child was stillborn or deadborn. So that's first we have to differentiate. Stillborn is a child who is alive at the time of delivery, but it has died immediately after that. Deadborn is that the child was dead inside the womb itself and it was delivered like a dead. Then you have to know whether the child has attained viability or not. So viability is determined by the age of the fetus. So usually more than 7 months of gestation age or 280 days of gestation is considered as viable child. This is determined by different methods like ossification, one of the method, ossification centers, and then growth, head length, abdominal girth. So these are different methods to determine whether the child was viable or not. So only viable child is considered as whether the child. So if the child is viable, it indicates that it can live independently without the assistance of mother. Whether the child was born alive or not, the time of after delivery. After delivery, it was child was alive or it was dead. So if the child was alive and survived after a few days, it will become a very serious offense. If born alive, how long the child was born alive, it has to be also determined. Then what was the cause of death? Whether the death cause of death was natural death or it's some unnatural death or some homicidal method, that has to be determined by doing autopsy. So during autopsy, that is post-examination, first foremost step is the identification of the body. So this is done mainly by the relatives of the child. So relatives may include like mother or husband, mother or the father. Then you have to do radiological examination. So radiography of the whole body of the child is taken. This helps to determine the age of the fetus, age of the child, and usually by ossification centers. So different ossification centers are looked for to determine the approximate age of the fetus, and it will be helpful to know whether the child was viable infant or not. Then photographs of external features are taken for reference. Then normal procedure of autopsy is done, which is similar to that of an adult. Then you go for external examination. So for external examination, first you look for clothings and wrappings which should be examined, which retain the for identification purpose. Sometimes The child may be wrapped with the mother's sari or clothings, which may helpful to determine the identify the parents of the child. Then you go for measurements like of head, chest, abdomen circumferences, length, the length of the fetus from crown to rump, crown to heel, and foot for fetuses, and weight of the body, which helps in determining the gestation age. So these all measurements are done to determine the gestation age again, which will help to determine the viability of child. Then you go for distribution and quality of hair over the head, rest of the body are should be noted. So how the hair distribution is, it is normal or abnormal, which indicates the normal growth of the child. Then frontanelar dimensions are measured again to determine the child. If the frontaneous measurements are exaggerated, indicate that there may be some fluid accumulation, hydrocephalus may be present, which may be which may be cause the child to die. Then configuration of it is examined and plasticity is evaluated. That is the movement of the cartilage is examined to know the development stage of the child. Then facial features are examined to know whether the child facial features are normal and all the features are non-growth normally without any obstruction to the nose or mouth. Then abnormalities of shape of the head related to molding, trauma, soft tissue edema, hemorrhage, atolosis should be noted. So these are changes like molding is present if there is a trauma head present is there and if enema is present that has to be noted which will be helpful to determine the cause of death. Then you look for putrefaction changes. The putrefaction occurs mainly because of the presence of bacteria in the gut, but since the child, infant which born, the gut is sterile, usually putrefaction occurs from outside to inside. In the infant, if it is death immediately after the birth, but if the child survive few days or few months, weeks, then the putrefaction it will start from the inside to outside. There is also a condition called maceration, where it is seen in the dead bone, which is a curious sign of dead bone child. This is a form of aseptic putrefaction, which occurs in the inside the womb of a mother, where the child has died inside the womb. Then this form of putrefaction occurs. Then you look for vernix gaseosa, which is like a cheesy material present on the body. If it is washed, it suggests that the child is survived for some time after birth. If it is intact, that indicates that that child may have died within the first within after birth only. Then we look for placenta if it present. We should be wait to evaluate maturity and any abnormality if it is present. If a abnormality is present, indicates that the child may not be developed normally and it may have died because of normal causes. The umbilical cord is examined, whether how it is cut, whether the presence of vital reaction in it should be noted, whether it was dead bone, then the vital reaction not present. If the cut end is clean cut or if it is ragged, so ragged cut indicates they may lead to infections and that child may have died because of infection. Then you look for injuries all over the body. If any injuries are present, like incised mark, bruising, some of beating, like asphyxial signs, all should be noted. Particularly on nose, mouth, and frenulum. When the any person may try to smother the child, then the injuries will be present near the nose and mouth. Then swab should be taken from every orifices like nose, mouth, vagina, if anus. So like a case of sexual assault, and since the cases of sexual assault may be also be present, so swab should be taken. Then you go for internal examination. So internal examination, it is done by modified form of incision. So modified incision, Y-shaped incision is preferred. So it starts from the mastoid process of both the sides near the joints of the midclavicular joint. Then from midclavicular joint, it goes to sternum. Then sternum to the midline to the pubis. So that is incision is done. Then in cranium, the ear-to-ear incision is taken, similar to that of adults. To remove the bane, the first scalp is examined for subappendix hemorrhages to exclude any asphyxia, dew bruises, or any form of injury. Then Benekis technique is used to open the skull. So in this technique, there is a incision is taken from the anterior fontanella from the about 1 centimeter from the midline. Then it is extended posteriorly and flap is taken. So this is extended in both the sides and removed. One central part of the midline is it is kept intact. With that, sinuses is also kept intact for intact to note for any hemorrhages. Alternate method is used where the incision is taken along the sutures like coronal sutures, sagittal sutures. Incision is taken, then skull is removed and examined for dura sub hemorrhages, subarachnoid dura hemorrhages, subarachnoid hemorrhages, and any clot formation has to be noted. The neck is examined for internal injuries. Take care of foreign bodies, froth, mucus, or any amniotic fluid should be noted. Then thorax is examined. So before examining thoracic, abdomen is opened to know the position of the diaphragm. So diaphragm position is noted to know whether the child was born. If the child was born live, then if it is breathed, then the diaphragm will be lower position, that is below the fifth, at the level of 4th to 5th rib. If it is not breathed the air, then because lung is still collapsed, it will be represented the 3rd to 4th rib. The whole chest cavity should be opened under water to know whether if pneumothorax is suspected. If under water, if removed, then bubbles will be demonstrated. The bubbles can be demonstrated. Notice made whether that there is any presence of free blood or fluid, pus or stomach contents present in thorax or abdominal cavity, or whether the diaphragm is ruptured or not. Then we should look for ribs, fracture of ribs if present should be noted. Any evidence for malformation of birth injuries should meticulously search, which may reveal obvious incompatibility with the continuation of life. So all the evidence which are present has to be noted. Then for anything has to noted. Then usually Lettius technique is used for to remove the viscera. Lettius en masse technique is used from anus. The viscera are dissected. Then all the viscera, lungs, stomach, heart, genitalia are dissected, and for look for any cause of the cause of death, for either it is normal or any abnormal causes should be noted. Limbs and sternum are particularly dissected in case of infants to determine the age of the fetus. So they examine for presence of oxygen centers to determine the age of the fetus. Usually, center for aspiration for calcaneum appears by the 5th month, 4 divisions of sternum by 6th month, tailus by 7th month, lower end of femur by 9th month. So ossuary centers in cartilage usually looks like a white patch inside the cartilage. So cartilage will be transparent, but in ossuary, if the ossuary centers are present, they look like a white chalky materials in the inside the joint. So that at the 9th month there will be femur will be present. It also the cuboid and upper end of tibia centers will be starts to appear at the on the 9th month. So if these centers are present, that indicates that the child was 9 month old or full term child. So and if there is a center for dialysis present, indicates that the child was viable child. So that will be helpful to know the viability of the child also. These are my references. Thank you.